this month for distribution, for jab exercise, but it looks like Kenyans will have to wait for long. So let me bring in the same member of parliament, that is Dr. James Nyikal, just to pick his mind about these vaccines, the AstraZeneca vaccine that Kenyans are actually waiting for. But the saddest thing or questions that Kenyans are having in their mind is, why bring a vaccine that's been termed as ineffective in other countries like South Africa? We shall also be talking about, how this should be distributed. Of course, the government talking about the frontline workers, being the first people to get this vaccine, then followed by the elderly in the society. But what does this mean for the country in terms of flattening the curve of Covid-19, in terms of the country's budget, and of course, when it comes to the storage of the vaccine? And that is something that my colleague, our Health and Science reporter, Sada Hassan, has touched on in that report that we saw earlier on before hearing what the CAS for Health had to say. So I bring in a senior member of parliament, Dr. James Nyikal, into this conversation. And Honorable Nyikal, good morning. Thank you so much for talking to us here on KTN. You sent, you're a doctor, and you've practiced medicine. Just kindly talk to us about this vaccine, a vaccine that has actually seen people ask questions. Why is Kenya ordering for a vaccine that has been termed as ineffective in other countries like South Africa, that is also talking about a new variant of the coronavirus?
Well, thank you very much. I think the country finds itself in a tough situation. The AstraZeneca vaccine has some advantages, and the advantages, one is cost. I think it's about 700 shillings a dose. The others are more expensive. Two, it is easy to keep in the cold chain, which means it does not require very, very low temperatures that may be difficult to attain. The temperature that it requires down to minus 20 degrees centigrade is in the same range as the ones that we use for our other vaccines that are for childhood diseases. So it means it is easier to get that done. The other reason, in my view, that I would pick it as a country is that this vaccine is Oxford AstraZeneca. The Oxford group did some trial on it, and that trial Kenya was also involved. So presumably we have some experience with it. Now the disadvantage, and the concern that you raise is actually real, that there's a variant in South Africa that seems not to be sensitive to this, which means that the vaccine may not protect those who are vaccinated against this variant.
But then,
now,
Dr. Nyikal,
the situation we are in, that variant is in South Africa. Yes, that variant is in South Africa. We don't have it here as yet. And then there has been an advisory from the World Health Organization that as things are now, it is better to have this. And what countries should do is make sure they control it, so they go for the control measures so that they try as much as possible that this variant doesn't go in now.
But then, Dr. Nyikal, yes,
The other thing is that...
Dr. Nyikal, allow me to cut you short. Yes, you're saying that, okay, Kenya doesn't have the new variant of COVID-19, but of course, the national government, through the Ministry of Health, sent a warning to all the 47 county bosses, telling them that they need to be vigilant. But my question is, should we report cases of the new variant in the country, and already we've ordered for, the vaccine that has already been termed as not being effective in handling, in protecting Kenyans or a person from the new variant?
What I would do with that, if I was in the ministry, I would then consider the amounts that I'm ordering, take into consideration that sooner or later I may have to change. But as things now, the advantages for this one may be actually better, because the others, if you take like the Moderna vaccine, which will require minus 70, the country will just not be able to manage the cold chain system. So it means that if you order it, the disadvantage of the temperature control will far outweigh the disadvantage you have with the AstraZeneca in a case where you still do not have the cases. My response would be, I won't go for a large order. I would go for an order and checking what is going on, so that if I need to change, then I change. You don't get to a situation like South Africa, where they are actually trying to get it to other countries.
So
but the WHO advice is important. In all these cases, you have to say, if I go this direction, what are my dangers? If I go this direction, what are my dangers? Then you take the danger, the least danger for you at that time. And I think at this point in time, the AstraZeneca may still be more useful than going for the ones which will have to have a new cold chain completely.
But then from the explanation, Daktari, then it begs the question, is the country really ready for the rollout of the vaccine in terms of storage? Do we need more refrigeration facilities in terms of the jab distribution? Does the Ministry of Health need more health workers in terms of training, in terms of employment, and also just to ensure that all the 47 counties, especially counties that have reported high cases, get this vaccine?
Well, I think there's a good point you are raising. You see, right now, as we probably read in the papers that we have had, they are talking of phase 1, which will be about 1.25 million people that they are looking at. The cold chain vaccine that we have is taking care of a population of children that are born every year, which is somewhere between maybe 1.5 or just above 1.5 million every year, which means we must now start thinking that we will have to expand the cold chain system as we have it now. And it is not only the cold chain system you expand, you will also need more health workers. You could get away if you had a health workforce that was stable and not having strike like we have. You could stretch them to actually do more work, but definitely you will need more people. When you are going into phase 2, as they are saying, where they are looking over something like 9.7 million people, that will be almost nearly 8 times what we require now. More people will be needed, more infrastructure will be needed, and even more supplies. You know, vaccines come with syringes, cotton swabs, all the things that you need to actually do the vaccine. It's not just the vaccine in the bottle itself.
But then from what you're saying, still the Ministry of Health is talking in terms of the funds are stretched out. And so they'll be relying more on the World Bank, the county governments, and of course the national government and donation from donors. So how can the ministry go about this in terms of financially supporting this jab process that the country is about to go through, in terms of bringing the funds together, what they need and how much they'll need? Because we're talking about 34 billion shillings, around 340 billion shillings in terms of everything, buying the equipment for vaccination, buying the vaccines, training of health workers, buying the storage facilities.
Well, this is something that as a country we must do. The continent has been lucky that the disease is not as killing people as much as in other countries, but we can't go on that luck only. So that preparation and the need for the money is there. We are just starting the budget process. I think this parliament has just opened this week, and we are going to get the budget policy statement. I assume that in that budget policy statement, the ministry has taken into consideration all these phases that they're planning to do the vaccinations and the requirements that they have. I can assure you that from the health committee, we will take this as a priority, because if we don't protect people, then actually we'll spend more when they're sick, whether we like it or not, apart from the fact that people are dying. And they are targeting 40%, but really you would have gone for 70%, because if you want herd immunity, then by the time 70% of the people are vaccinated, you are almost now safe. But then, maybe 40% is a good target at this point.
But then, Dr. Nyikal, being a medic, being in the, the National Assembly Health Committee, kindly, I'd like to pick your mind on this. Take us through how the process will be, because once a person has been jabbed, the government is targeting for the first quarter about 1.2 million Kenyans to get the jab. So you've been vaccinated. So how will the government do the follow-up in terms of, okay, this person has been given the jab, follow-up in terms of the effects of the vaccine on an individual who has not gotten, who has gotten this vaccine, and a follow-up in terms of ever since you got the vaccine, have you ever, contracted the virus? And once you had the virus, when you're given this vaccine, how immediate did you get over COVID-19?
Well, you see, there's a monitoring process. There's a health information system that is in place that will work along with this, so that we are getting information of how many people are infected and how many people are getting sick. What we expect that is when the vaccination start, we should expect these numbers to drop with time. So that health information must now take into consideration that they are now looking for people who have been vaccinated and whether they get sick. So that when you get sick, the questions you will be asked will be, were you vaccinated? Now, if we start getting people who are vaccinated getting sick, then that's a dangerous issue. But those numbers will be important even to know the efficacy of the vaccine and our efficiency in doing it. At the same time, we have research institutions like Cambridge. I think they must by now put in place research questions and research systems that are going to monitor that as a country, as we give the vaccines, what is happening. There must be epidemiologists that are doing community research, that are doing epidemiology, that are doing public health surveys, so that we know. That is what we need. It is not just that the ministry giving the vaccines and staying there. There must be the information system, the research institutions, even the University of Nairobi, the public health department, and other universities of public health can actually chip in and start getting this information to know how the vaccines are how effective they are. And in the situation where we know that in some countries, like South Africa, there's a variant where the vaccine may not be effective, we should even be more alert that first of all, we check, are those variants in the country? And if people are getting vaccines, how are they responding to the vaccines? This is a new situation, but I think we have the systems. If we apply the systems and put more emphasis and on our part, probably as Parliament, actually budget in more money to look at the COVID, then I think the country should be able to contain it. The problem is, in fact, our financial situation in the country.
In fact, Dr. Nyikal, I like the fact that you've said, Parliament will be there to do the oversight work. And, this is the point where, allow me to say this, I'm just trying to be the devil's advocate and not looking for negativity in all this time, during this time, actually, when the country is trying to find a lasting solution. But in terms of accountability, because you're talking about billions and billions of shillings to be spent, on this vaccine. You're talking about 11.9 billion shillings as the cost of COVID-19 vaccine and injection devices. How is the National Assembly Health Committee, what are you going to do as members of that committee to ensure that every coin that has been set aside for this exercise is done, is used in a transparent manner, such that accountability is done at the Ministry of Health and, in short, in the government?
Well, let me agree with you that being the devil's advocate is not a bad thing. It's actually those who bring out the worst case scenario that actually help situations. And let me first of all get a warning to Kenyans in general before we come to Parliament, and in particularly business people. I know these vaccines, we are going to put more money in it. There shouldn't be people there who are out purely to make profit, sometimes not even profit, to steal, because then it will be impossible. We have seen this when we are talking of COVID, and we had the PPEs and all the things we needed for the prevention. What happened at KEMSA? Please, we'll tell those people in business, people in government, that this is not the time to look for wealth. This is the time to look at the well-being of the country. Obviously, as a health committee, we actually must be now on the lookout. We saw what happened, and I think what I will propose when we get to the committee is that we actually get very frequent briefing on the expenditure that is relating to the vaccinations program that is coming. In fact, you indicated that we expected the vaccines to come earlier and that they may get late. Even that, we are now actually to call for from briefing from the Ministry of Health to know exactly when are the vaccines coming, exactly when are we starting, what are the programs. And then we'll also put at the same time want to know the expenditure, the procurement system that is going on. I think even the national, the Kenya National Audit Department must also be on this. Audits are not only after the events, but we should even have preemptive audits and preventive audits. So that we know we have been beaten, we should be twice shy.
All right. I like your closing sentiments. You've been beaten and twice shy. We just hope that all the funds that have been set aside for this vaccine will be used in a prudent and transparent manner. Thank you so much, Dr. James Nyikal Seme, a member
We'll try our best. We'll really try our best at the Health Committee.
All right. Asante Sana Daktari, the Member of Parliament for Seme, talking to us about this COVID-19 vaccine and what Parliament, the National Assembly Health Committee, is going to do to ensure that everything is done in the right manner, right from procurement of the vaccine to distribution in terms of jabs that will be done. All right, so far you're up to date with what is making the headlines at 10:32 a.m. on KTN News Center. Allow me to take a short commercial break. I'll be right back with more news making the headlines.